Michael Goodluck, biology and medicine videos. Join the group, post interesting things like comments, answer questions, and subscribe to the group to get more information about medicine. In this video, we are going to look at cesarean section. Cesarean section. What many know as C-section. Now, in this topic, we want to look at what is cesarean section introduction. We'll be looking at the conditions for this procedure. Conditions for the procedure. We'll be looking at the preparation for the procedure. How doctors are prepared and the patient is prepared. We'll also be looking at the procedure itself, how the procedure is done, how the procedure is carried out. All done, then we shall look at the post-procedure care. So you can talk of pre-procedure care and post-procedure care. Well, cesarean section. I'm calling it as C-section. That is how it's commonly known as C-section. Is a procedure used to deliver a baby. Procedure used to deliver a baby or babies. Yes, because can be one, can be two, can be many. Through surgical incision. Through surgical incision of abdomen and the uterus. That means they cut the abdomen and they cut the uterus to remove or to get out the baby. A procedure used to deliver. Just only this word may let you know that they want to remove the baby from the mother's uterus. As brief as that. I may not take you far to the history, how it began and so forth, but this is only enough for you as a surgeon. Why is it done? Why is it done? Why do surgeons do C-section? A healthcare provider might recommend a C-section if, one, labor isn't progressing normally. When the labor is not progressing normally, we can also call it labor dystocia. Labor dystocia. Labor dystocia includes prolonged first stage. Include prolonged dilation or opening of cervix. Include prolonged dilation, prolonged dilation or opening of cervix, opening of the cervix. And in this, we can call it prolonged first stage. So in the first stage, there could be a challenge in dilation. There can be a challenge in opening of the cervix. Then, labor dystocia also include the prolonged time of pushing the baby. Prolonged time of pushing the baby. But the dilation, but the cervix dilated or the cervix is open. When cervix is open, but the pushing is that as delayed with cervix open. With cervix open. So this condition might result a surgeon or a doctor to perform a C-section on a mother. Another condition that is needed for a C-section is the baby is in distress. When the baby is in distress, like the heartbeat of the baby is not normal, abnormal heartbeat. Of the baby. Another indication for cesarean section is when the baby or babies are in unusual position. For instance, you find the baby is coming out with the shoulder. For instance, you may find a baby buttocks coming first. For instance, you may find a baby buttocks or legs are bathed in canal. Talk of buttocks and legs bathed in canal. Or you find the umbilical cord is prolapsed. Or prolapse umbilical cord, like the umbilical cord is fast coming out in front of the baby. Or can also be a challenge or a problem of hydrocephalus. Like the baby's head has absorbed some excess fluids that makes it so big and the mother cannot push. So this mother may require cesarean section or what you know as a C-section. Another one is when there is a blockage. When there is a blockage. What brings the blockage? One can be fibroids. When the woman has or the mother has developed fibroids, brings the blockage. The first, she's in pain, cannot push the baby, and secondly, the swellings themselves, the fibroids themselves, can block the smooth passing of the baby. Another one also the same is hydrocephalus. A baby's head is too big for the mother or the mother to push. Another one is prolonged umbilical cord or umbilical cord, which we have already discussed, and so many other conditions can also be even cancerous. Then lastly, that we can talk among others, is just normal weakness of the mother. When the mother is too weak to push, or the mother has got other complications that cannot allow her to push the baby. Talk about other medical complications. That may not allow the mother to push the babies, and so many more. I hope this will make sense. In the next video, we shall be looking at the preparation or pre-procedure care. Then we shall be looking at how the procedure is carried out in the theater. Then lastly, we shall be looking at the post-procedure care. How do we care for the mother and the baby after the procedure? Thank you.